I am really, really pleased to be here with you all this evening. I bring you greetings from my employer, our organization, Progress Florida. We are working statewide to move Florida toward a more progressive future, and that is on many different social justice and economic justice levels. I have partners here at Progress Florida who are working on fair courts, who are working on environmental sustainability and other issues. Of course, I'm working on reproductive rights. And, one of the things that I wanted to lift up is here at the beginning is like, why should people care about reproductive justice and reproductive health? I mean, what's the big freaking deal? Why is this the big news topic in the political arena? Well, if we go back to the basics and we think about how healthcare affects us as people, as productive people, happy people, well-adjusted people, honestly, as adults, our ability to control our childbearing is one of the most important things that predicts whether or not we're going to be able to live up to our potential, to pursue happiness and, sort of the American dream, if you will. And we know that if a woman, or someone with a uterus can decide when or if they're going to have children, how many children they're going to have, and the spacing between them, they will be able to control their destiny much, much more. And so it is beholden upon us to protect reproductive rights like we do all the other important public health measures. Every modern American medical or healthcare setting has abortion as part of its services, just as they have birth control and other family planning programs, and just as they, should have all kinds of comprehensive care. So what's the situation here in Florida? Just to precede us talking about Amendment 4. You all know that with the fall of Roe v. Wade, with the U.S. Supreme Court's Dobbs decision in the summer of 2022, it made the 15-week abortion ban, which had just passed, a lot more likely to go into effect. Now, the fact is, it's our privacy clause in our state constitution that was also in play. But unfortunately, earlier this month, on April 1st, April Fool's Day, the Florida Supreme Court rendered its decision that said that the privacy clause did not cover abortion care. And with that decision, they did away with 40 years of precedence of justices who had served on that bench, who had decided differently. But politics is at play now. We have a very different court, a much more pinched view about things that have to do with personal freedom. And so they rendered that decision. And because the privacy clause that was deemed not to cover abortion, the more draconian 6-week abortion ban, which the legislature passed in 2023, is now going to be allowed to go into effect. And that will happen on May 1st, so just in a couple of weeks. You all know what that means for comprehensive reproductive health providers across the state. They have patients who've discovered that they are unintentionally pregnant and need to end the pregnancy, and they are scurrying to meet this deadline if they're getting close to 6 weeks, which actually would be almost everyone who's unintentionally pregnant, because they would only discover that they're pregnant when they miss that first menstrual cycle or soon thereafter. So it doesn't give people a lot of time. And y'all remember that even before these abortion bans passed, we already had some serious restrictions in our state. We already had the two visit requirement, that a patient who is trying to get abortion care has to visit their doctor, not just a nurse, not a nurse who's in that practice, but a doctor 2 times, and there has to be at least 24 hours in between. There also are informed consent requirements where every patient who's seeking abortion care has to be presented by these very biased state-mandated, state-printed materials, even though they're not medically accurate, but it's required by our legislature, and so many other things. But anyway, we are facing a public health emergency in the state and throughout the whole Southeast. Florida doctors until the end of this month, are providing more abortions than doctors in any other state other than California. There is no way that all the other abortion states that still are allowing abortion can possibly absorb the full load that Florida doctors have been carrying. So we are definitely facing a public health emergency. So it has become clear to us, in those of us who work day in and day out in the reproductive rights movement, that decisions around abortion need to be taken out of the hands of politicians and given over to voters. And the ballot initiative is our main option for fighting against abortion bans. We are lucky that in Florida, we still have that in our democracy toolbox. You know, only 25 states allow that sort of direct democracy in terms of its state constitution. And we happen to be in one where that is where citizens are allowed to present things. In other states, there are no, either they're not allowed at all, or the state legislature has to come up with them. So we're lucky that we still have that right. But I'm sure you'll agree that we need abortion to be explicitly named as a constitutionally protected right in our state constitution. The ballot measure that we have put together will succeed if we, as in November, if we do a proper job of getting voters informed about it. Our poll after poll has showed that Florida voters do support access to abortion. And that kind of, and like back in 2022, late 2022, which would have been, you know, about a year and a half ago, there was, FAU did a poll that showed that 67% of Floridians support access to abortion. That support has only gone up since the 6-week ban was passed. So as we're getting it on the ballot, we believe that we can win. And work on this ballot initiative has been very collaborative. Lots and lots of different organizations and stakeholders have been involved. And from the beginning, we've been very, very, very intentional and careful to include the voices of those who understand the lived impact of what these abortion bans are all about. And that includes people from low-income communities, people from communities of color, people from immigrant communities, et cetera. But we've also had experts like constitutional law experts and ballot initiative experts who have worked to draft language that would really everyone could get behind who was in the coalition. And there have been, you know, grassroots organizations involved like the ACLU, Florida Rising, Women's Voices of Southwest Florida, of course, Planned Parenthood, ACLU, and all of these groups have helped. And a bunch of partners from our Reproductive Rights Coalition, which is called Floridians for Reproductive Freedom, have been involved. And so as you can see on the slide, the title is the Amendment to Limit Interference, the Amendment to Limit Government Interference with Abortion. And it reads that no law shall prohibit, penalize, delay, or restrict abortion before viability or when necessary to protect the patient's health as determined by the healthcare provider. So the process we had to go through, though, and a lot of you are familiar with this, probably you've been participating in the Medicaid for All petition collection and perhaps the former Amendment 4 petition collection, which was to get returning citizens their voting rights restored. I'm sure many of you, I recognize your names, I know you're activists, so you're very familiar with this, but just to be sure, in order to get on the ballot, citizens groups have to collect nearly 900,000 petitions. And those petitions have to be from geographically diverse areas. They can't all just be from metropolitan areas. The government wants us to show that it has broad support. So we needed a ton, and we got them. And we got them by the deadline, which was the end of December. Well, that was our personal deadline. After that, Division of Elections assigned us a number, which was Amendment 4. We love that amendment because it's the same number as the Voting Rights Restoration Amendment was. It's also pretty cool because you can remember it, Amendment 4 on November 4th in 2024. And so our campaign is called Yes on 4. Now we have, and as you all know, the Supreme Court also on April 1st approved. We went through that final hurdle of them saying, yes, the amendment is understandable to most Florida voters. It is within the word limit, and it's only about one issue. So we got through that. And now we're moving into what we're calling the voter persuasion campaign, which is when we're going to be working to identify voters who are very likely to vote yes on Amendment 4, make sure they're educated on it and understand what it's about, that they're ready to vote in terms of their voter registration is set, they have a vote by mail order in if they wish, and that they know if they want to vote on election day, that they know where their polling place is and that they're ready to do it. And then, of course, we'll be tracking them to make sure they actually follow through on all of these things. And in the final days and weeks prior to November 4th, we'll be running a very, very energetic Get Out the Vote campaign. This coming Saturday is a very important day for Yes on 4. Last week, a lot of you, I can recognize you, and I know that you were in Orlando for our launch event, which was a big statewide rally in March in downtown Orlando. And now this coming Saturday is really our big learning event. There are probably around 12 different localities around the state. There are going to be in-person teach-ins where all of our supporters are anyone who signs up is going to be able to come and hear the very best research-based communications or messaging that we can use when we interface with voters. This is really important because, I've heard many communications professionals say that there is no more nuanced language in the political arena than around abortion. It's really important that we get our language right because it's easy to turn people off when you're talking about a sensitive issue like abortion. And we have tested language and we know what works and we know what might not. And so if folks are moved by this, please try to attend Super Saturday in your region. Or if you can't get out or there's not one in your area, there is a virtual option. All of these events start at 10 a.m. They run from 10 to 12 this coming Saturday. Now, I tell you, there's going to be a Super Saturday every month between now and the election. So if you can't make it this time, don't worry, because in May, there'll be another Super Saturday that will have a different theme and that will serve, hopefully, to mobilize our supporters in another way, in a different way. But it will be an exciting opportunity for people to get plugged in and engaged with the campaign. By the way, I forgot to mention this. On the bottom of a lot of these slides, you may have noticed this link tree. This leads to a link tree I've developed that has all the links that you might need as I'm going through this PowerPoint or this slideshow. So perhaps you could take a picture. I don't know if I can grab it. Oops, sorry. I can't grab it, but I will try to type it in chat definitely by the time I'm finished. Or if someone else could potentially type it into chat for me, just so that you all will have it at your fingertips. But that link tree can take you to the registration page for all the events that are happening across the state. You can see the map where they're going to be, as well as general information about Amendment 4 and other repro topics. But other things that, if you are interested in getting more engaged in our movement in general, I would urge you to consider signing up for our mailing list. The coalition, the Repro Coalition, Floridians for Reproductive Freedom. We have a newsletter that comes out every Friday by my colleague here at Progress Florida. Her name is Cheyenne Drews. And Cheyenne sends a fantastic newsletter with important news articles, as well as action alerts, job openings, important events in the repro space happening across the state. It's really a real good way to stay informed. Also, I would urge you to amplify on social media, whether it's your organizational social media or your personal channels, stuff that's put out by the coalition, by the Yes on 4 campaign, by Progress Florida. All of those things will help us spread the word and end stigma around abortion. The more that we all post about it, talk about it like it's a normal thing, the more people will believe that it is. Because you know what? It is. 1 in 4 American women will access abortion care during their childbearing years. 1 in 4. It is a very typical medical procedure or protocol that people need and they do access. Also, I would just, anything we can do to put forward this theme of getting government interference out of our personal healthcare decisions and out of the abortion care delivery is going to work with most voters. I know that your organization is nonpartisan, and so is the Yes on 4 campaign. We have to be nonpartisan, because if we just start counting on Democrats to win this, we will lose. You all know that Democrats make up less than a third of the Florida electorate, and that is not the 60% that we have to win. So it's really important that when we talk about this, we don't define it as a Democratic turnout sort of race, because that will turn off the Republicans who believe in abortion access but aren't going to want to help Democrats. Try to stick with nonpartisan language and stick to the messaging that we need to get politicians out of healthcare decisions, like out of personal healthcare decisions. Writing letters to the editor, posting to your blog, all of those things are critical communications tools that we need folks to be using. The other thing I would invite you to consider doing, and I would actually urge you to do, is to get familiar with medication abortion or abortion pills and spread the word on the concept of self-managed abortion. And by self-managed abortion, I mean accessing abortion pills outside of the traditional medical health care system. These pills are extremely safe and they are extremely effective. Most providers in the United States, or most, let's say, international drugstores, international medical practices, and even telehealth practices operating out of states where abortion is very unrestricted, they most often use this protocol that you'll see on the slide, just 1 round mifepristone pill, followed by 6 misoprostol, or these 6 hexagon shapes. And if taken according to the directions, this combination of medicine will bring on a miscarriage. And it is safe. I mean, it's been FDA approved for more than 2 decades, and it has been legal here for that amount of time. It is safer than, say, Viagra, safer than penicillin, even safer than Tylenol. Now, so it is a very effective and safe medication, and people are accessing it more and more through the mail. Pills by mail, just like they are accessing all kinds of other pharmaceuticals, prescription medications through the mail. It is, as I've stated, it is available online, purchasing from overseas suppliers. PlanCpills.org is a website that many people turn to find out about providers. Now, PlanCpills.org, once someone puts in their zip code, it actually provides first and foremost the local providers in that person's area, like in St. Petersburg, where I am, it would provide me with a list of abortion providers in the Tampa Bay area. But then it would also provide, it asked me if I want to know about online sources, telehealth sources, and I might find out about the MAP, which is like, I think it's called the Massachusetts Access Project or something like that. But because Massachusetts has a shield law that protects the doctors there, even if they're providing care to people in other states, including restricted states, the doctors there have set up an amazing telehealth project, and they are shipping drugs to every state in the United States by the hundreds, by the thousands. So anyway, PlanCpills.org is a great website. It's one that, as we move into the 6-week ban, more Floridians need to know about so that they can access care in that way should they decide. Now, one thing I don't want to do is understate the potential risk associated with these pills. And I'm not talking about medical risk, because they are very safe. I'm talking about legal risk. Even though there have been very few arrests, they have happened in other states. Now, in the meantime, I'll just mention this. We have one of the vendors reported that they have shipped in the last 6 months over 30,000 packets across the United States to American addresses. So we know the pills are safely getting to people, but there have been cases where someone disclosed to an anti-abortion healthcare provider that they'd taken these pills, and they have been, and the police were called, and that person was prosecuted. Not in Florida, but it's happened in other states. So there is some risk involved with it, but that could happen. Especially more of a risk in populations that are already over policed, like in Black communities and among undocumented folks. So, you know, I just want folks to be aware of that. There is an amazing nonprofit law firm called If, When, How that will consult on any of these things. I do offer a webinar, a Train the Trainer event, where folks can come and learn more about the abortion pills. But the point of the training is actually to get folks to go out in their communities and to train others on how to safely and effectively talk about abortion pills and spread the word. Really, I would love this project to snowball across the state, across the country, so that there are trainers everywhere helping people know how they can legally get away with sharing information about abortion pills. Our next one is the 16th of May. It's a Thursday evening at 5:30. And the registration for that is available through that link tree.